Hello everyone, welcome to this lecture. In this lecture, we'll be studying about different type of study designs. So first one is case crossover design. It's a type of case control study. To study the etiology of acute outcomes, we use this study. So same individual is a both case and the control. We have risk period and control period. Exposure just before an acute event is a risk period and exposure at another time is a control period. From the disease, we go backward, ask about the history of exposure like case control study. So the time goes this way, inquiry goes the opposite way. For example, between vertical line each month, January, February, March and April. And in between one line is there. That vertical line divide whole month into 2 weeks and 2 weeks. Shaded area represent the air pollution. This heart symbol represent the occurrence of myocardial infarction. As we study, the risk period is just before the acute event. 2 weeks before the onset of MI, we are going to take as a risk period. So this is risk period. This one is risk period. This one is risk period. 1 month before the onset of MI will be the control period for that. For this MI, this is control period. This MI, B, control period will be this period. Third, C MI, the control period is here. In A case, B case, C case, during risk period there was air pollution. Only B has air pollution during the control period. In A and C, there was no air pollution during the control period. Just to assess, is there any association between air pollution and MI and short period of time. Just to study the etiology of acute outcomes, we use this case crossover design. Next study, nested case control study. It's a type of cohort study. First we will be defining the cohort like cohort study. Then we may get the outcome like disease. Some people may develop disease, some may not develop the disease. So we are going to take those who develop the disease as a case and those who didn't develop the case we are going to take as a control, and we'll do cross-sectional study and ask about the exposure history. Controls are chosen from the defined cohort at the time each cases occur. Here single disease is studied in this way. This is defined cohort. From some of them might have developed the disease, some of them haven't developed the disease. Here time, first year, second year, third year of follow-up, fourth year of follow-up and fifth year of follow-up. Case 1 developed at the end of the first year. So we are going to choose control for that case same time, and for case 2 developed at the end of second year. So we'll be selecting control at the end of second year. Likewise case 3 and 4 developed at the end of fourth year. So we'll be taking control at the end of fourth year. And next one is fifth year. We'll be taking control in fifth year. Next one is case cohort study. From defined cohort, those who develop the disease will be case. From the defined cohort, some of the population will be setting as a control at the beginning of the study. Sub-cohort is selected as a control at the baseline. They might develop the disease in later and may contribute to both cases and the control group. So here multiple outcomes are studied. See, again same defined cohort, and at baseline, at the start of the study only, we are going to select a part of people from this defined cohort as a control. They might develop the disease in future, doesn't matter. At the end of first year case 1, second year case 2, fourth year case 3 and 4, fifth year case 5. We have selected these controls already at the beginning of the study. Factorial design. It's a randomized control trial based study. In RCT, we can study only one intervention. Here we can give multiple intervention and study at the same time. So find the effect of each treatment separately and combined. More efficient than 2 separate RCT. 2x2 table, treatment A, treatment B. This positive represent we gave the treatment A, negative we didn't give the treatment A. B positive gave the treatment, B didn't give the treatment B. So here A and B treatment is given, here only B treatment is given, here A treatment is given, neither A nor B. If we want to evaluate treatment A, we have to compare A plus C cell with B plus D cell. So if we want to compare treatment B, we have to compare A plus B cell and C plus D cell. That is this way. For example, study population. Now we are going to give aspirin, that is treatment A, to one, and aspirin placebo to the other group. Whoever received aspirin, that group, for some people we are going to give beta carotene, for other we are going to give beta carotene placebo. Likewise, in aspirin placebo group, for some people beta carotene, some people beta carotene placebo. This is the 2/2 table, aspirin and beta carotene this side. So those who get aspirin and beta carotene will be in A cell, only beta carotene will be in B cell. Those who got aspirin only will be coming in the C cell. Aspirin neither beta carotene will be in the D cell. To evaluate the aspirin, we will be comparing A plus C with the B plus D. To evaluate beta carotene, we will be comparing A plus B with the C plus D. So this is factorial design. So we have studied something about a case crossover design, that is related to cross-sectional study. Nested case control study, that is related to cohort study, and case cohort study, that is related to cohort study, and factorial design related to RCT. So hope you understood the lecture, and thank you for listening.